Hi, I'm Dr. Kate Burkhardt. I'm here to talk a little bit about the interplay that has occurred in my life related to medicine, and I'm a psychologist, so I study the mental health aspect of medicine and the medical field. Secondary to that, I provide services for underserved populations. I come from Canada, so if you hear that out and about, that's why. Out and about, eh? So I earned my graduate degree at the University of Windsor, right across the river from Detroit, and I provided a lot of the services in Canada, and a lot of my training came from work with the Aboriginal population, the Inuit, who live in Canada's Arctic. So from there, I had come here and I began serving in California Department of Corrections and the Department of Mental Health. I've spent the last 10 years just about working with the state departments, the last 5 years at Salinas Valley State Prison. In the course of my career, in 2008, October of 2008, I suffered a cerebral aneurysm rupture with subarachnoid hemorrhage. I had an initial rupture and it became suddenly a patient. I went from being a doctor and understanding my life as a doctor in the doctor role to suddenly being a patient on completely the opposite end of the spectrum. And it was an invaluable experience to truly begin to comprehend what a patient feels like. In my case, and understanding the differences between Canada's healthcare system, where there's universal health coverage, and this system here, because I was on an HMO, I was required to have a pre-authorization, which seems absurd, but I was in a position of actually not having my aneurysm surgery and repair covered because I hadn't received a pre-authorization for it per my insurance company. Prior to actually obtaining the surgery, I thought it out and I realized I didn't have $250,000 in my back pocket that I could cover this. I delayed receiving intervention for 5 days. For whatever reason, the aneurysm had essentially coagulated for a period, and I suffered a second rupture on October 21st, at which point I was taken to the hospital with subarachnoid hemorrhage that was unidentifiable as to what was exactly going on because there was so much blood in my brain. From that point, I had a craniotomy performed with cerebral clipping. When I came out of it, I couldn't walk. I had difficulty understanding the world. And I also began to have difficulty understanding my role. Was I ever going to be a doctor again? The doctors in the system and the medical field were having a difficult time treating me, even as far as case conferences, that kind of thing. It was like, well, this is Dr. Burkhardt, she's here. She shouldn't really be a patient. We're not really understanding how the doctor's not supposed to get sick, the same way the ambulance is not supposed to get in an accident. So with that, I was thrown into this process unwittingly, I suppose I would call it. In the course of this time, I ended up residing in a group home, which of course any of us acknowledging that would sound a little embarrassing. I'm in a group home for brain injured people. No, wow, this isn't where I'm supposed to be, this isn't fit. Understanding our patients' experiences of what's going on and understanding that in a second we could be one of our patients and we could be part of this process. That said, I thought I was kind of getting it all back together again and doing pretty much okay when October 21st of the very next year, 2009, I suffered a massive grand mal seizure in the middle of the prison yard at Salinas Valley State Prison. And was taken on an ambulance with status epilepticus, rushed in full code to the hospital. They didn't know whether I was going to make it at that occasion. As a little segment in the middle of this, I had been placed on anti-seizure medications precautionarily and developed a very severe reaction called Stevens-Johnson syndrome. I had blisters all over and I was burning from the inside up. My white blood cell count went down rapidly until it was identified that I was actually being poisoned by the pills that I was taking. In the course of this then, I had developed a seizure disorder, and that was a bit of an occupational hazard as far as going back to work, but I pushed my way back into the prison system and was well accepted. Just to understand how we work with our patients, there was a patient of mine who had actually seen me rushed out of the prison in the ambulance. This fellow hadn't seen me for many months later. The inmates in a prison system aren't allowed to ask how their doctor's doing. Probably the same way that your patients can't ask how you're doing. And so 7 or 8 months later, this individual ran into me and he says, "Dr. Burkhardt, we thought you were dead. We didn't see you and you got moved to a different yard. We didn't know that you were okay." He shared a story with me. Now, keep in mind that these are the worst of the worst offenders, level 4 maximum security prison, the ones that we send away from neighborhoods just down the road, South Central, which is actually, by the way, where I work now. What had happened when he had seen me seizing, he had gone back to his cell and through the cell vent had passed along the message, "We need to pray for Dr. Burkhardt. She might die." They prayed for me that night, a series of level 4 maximum security inmates. And they brought this to their prayer meeting at the chapel that week. With that, I recognize that you can get hope and you can get inspired from just about anywhere if you're really open to it. I didn't know that that had gone on behind the walls. In the process of this then, people will look at me and they'll say, "But my gosh, there's nothing wrong with you. You're totally fine. You'd have no idea." Well, the part I can say with that is I have had multiple surgeries after this, not exactly related to the brain injury, but in a seizure I fell and I tore the labrum of my shoulder, and so I had to have full surgical repair. I fell again. I had no driver's license, that I actually gave it up before I had the seizures. And at that point, I fell again in a seizure while on rollerblades, because when you don't have a driver's license, you need to use rollerblades or a bicycle or walk to get around. A gallon of milk is real heavy when you have to carry it in a backpack. In considering all of these things, I have a large scar on my arm that you can actually see. You know what? I'll just show off my scar. This is the scar that I have from the surgery. The thing is, people will look at this scar and they'll say, "Wow, that's some scar you have. That's got to be the biggest injury you ever had." Well, you can't see the surgical fracture line on my head. You have no idea that it's there. And so in saying that everything's back together in your world, this is in sum at this point, it's not really. It is on the outside, it is externally. But like you can't see the fracture line, you can't see my fears, you can't see what's different in my life, you can't see what my experience has truly been. In understanding that, I went to a brain injury support group at one point, and there was a fellow who'd had a whiplash type accident, and nobody knew there was anything all that much wrong with him. His wife had sent him to go to a grocery store to get some cans of beans, a can of beans. He came home completely petrified, and he was sharing this at our support group. He said, "I just couldn't do it. I couldn't buy beans. I got there was a little can of beans, a big can of beans, a bigger, different kinds of beans, all his beans, too many cans of beans." The experience in my world often is too many cans of beans. The things that you have that you can prioritize and you place lists on, that kind of thing, I've been able, because of my organizational skills and my background and the aptitude that I had prior to the injury, to recompensate and get to a point that I can handle the cans of beans in my life on a pretty much daily basis and do okay with it. I'm blessed by the opportunity to be here, to be standing here, to be speaking here. I physically recovered pretty quickly. Within 6 months, I did a triathlon, the Olympic course at the Wildflower event. I was the last female finisher, and they had a huge group of people who came in behind me to celebrate my finishing of this. But the real recovery has had to come from my spirit, my soul, my heart. My experience of this world is totally different. The part that probably has hit me the most has been that I can no longer form memories of people's faces. I have a disorder called prosopagnosia as a result of the brain injury. And all of your faces, I may meet all of you. I've seen you. You might see me again in a week's time somewhere. I won't know that I've seen you until I hear your voice, until I have an impression of your personality or who you are, your character. Then I can feel you. The same way a blind person could perhaps understand their world and feel people and understand them. That has been a trial. But that's also been a blessing in disguise, because I've been able to understand the real reason why we're involved in this field of helping people and wanting to reach out for people. We need to be able to have a presence that people can feel, not just see about us, not just in recording the numbers and the data and all the chemistries involved, etc. That we actually need to feel our patients, recognizing that we're only one step away from being a patient. Nothing makes us any different. And that we have the opportunity to impact one another's lives on truly a moment-by-moment basis. Thank you.
It wasn't clear. Are you still practicing, and how has the practice changed?
I actually am still practicing. I fought my way back into the prison system, which was certainly a fight. Managed to come up with some safeguards that would indicate that I would be safe at work and that those around me would be safe. From there, most recently, I have been constantly troubled by the under-provision of services to minority populations and the identification that South Central Los Angeles doesn't even exist on a map. I've been here now in Los Angeles since November. I have tried to get a map. I have moved to South Central. I was offered a job opportunity to work with Shields for Families with an agency called Jericho. It's a program for ex-offenders paroling to Compton, Watts, Inglewood regions. Violent, non-violent, felonies, it doesn't matter. Anyone is accepted, and we assist them with job readiness, educational placement, and substance abuse, mental health, the full wraparound services within the agency. I was given this opportunity, and it meant a big sacrifice. It was stepping away from state employment that was actually fairly solid and half the salary, etc. But it was something where I knew I could truly make a difference. I could recognize that as my voice was quelled over the course of time that I was a patient, and as it was sort of the understanding that, well, if we just get through the system, you're fine, kick you out of the hospital, go off on your way, that we do the same to other people in other agencies, other industries. In the prison area, it's pretty much that way. And so I have come here, and I am currently serving as a program manager for the Jericho program. Again, another blessing that I've had that I would not have had as part of this process.